then do we know the difference between abortion and miscarriage? First, let's look at the similarities. When it comes to abortion and miscarriage, it means that the product of conception, what was growing inside the woman's uterus, was lost. When it comes to miscarriage, it's not often deliberate. It occurs spontaneously. That's why miscarriage sometimes is called a spontaneous abortion. It occurs spontaneously, not deliberate. So the lady wakes up one morning and realizes that she's losing her product of conception, or she had already lost her product of conception. She did not premeditate on losing it. So first and foremost, you need to define the intention. If the intention is deliberate, it's an abortion. If it happens spontaneously, then is a form of miscarriage. Nonetheless, it's important to know that there are certain risk factors that the individual may play in that may become a problem. For example, a pregnant woman getting herself exposed to. So I got this message. Nurse, I'm the lady that wrote about having a manual vacuum aspiration in February. My period finally came in March. Please, when is likely my fatal window and ovulation time? Now, this came as an anonymous message. I don't want to talk about what she asked, but I want to talk about a comment that was on this particular post when I wrote about it on my social media. So someone came up and said, "Madam, why don't you just say the truth? Did you do you said it was a miscarriage. Are you sure you did not do an abortion?" So today we want to talk about the difference between abortion and miscarriage. Welcome to this episode of the Intimate Matters podcast, a podcast that we discuss issues that surround sexual and reproductive health. On this podcast, we take you on a deep dive into the world of sexual and reproductive health and let you in on everything that you need to know about it. Please do well to subscribe to this channel and also to follow us on all our social media, Facebook, Instagram, TikTok, and also join our personal WhatsApp group. Do well to like this video, share, and also comment on this video. So, to the issue we are at hand. How then do we know the difference between abortion and miscarriage? First, let's look at the similarities. When it comes to abortion and miscarriage, it means that the product of conception, what was growing inside the woman's uterus, was lost. So she was right. It could be that it was a miscarriage. It could be that it was an abortion. But one thing we need to know is that that pregnancy was terminated before it came to term. By term, we mean that it came to a point that she could birth the child. First, what differentiates an abortion from a miscarriage is intent. What happened? What was the mindset? What was the reason behind the termination of that pregnancy? In abortion, the intent is deliberate. Yes, there's a product of conception. Yes, an embryo, a fetus is growing. Yes, I don't want it to keep growing again, so I want to stop it from growing. That oftentimes, the deliberateness of the intention makes it to be classified as an abortion. When it comes to miscarriage, it's not often deliberate. It occurs spontaneously. That's why miscarriage sometimes is called a spontaneous abortion. It occurs spontaneously, not deliberate. So the lady wakes up one morning and realizes that she's losing her product of conception, or she had already lost her product of conception. She did not premeditate on losing it. So first and foremost, you need to define the intention. If the intention is deliberate, it's an abortion. If it happens spontaneously, then is a form of miscarriage. Nonetheless, it's important to know that there are certain risk factors that the individual may play in that may become a problem. So there are certain risk factors. It may not have been intentional. You may not know that doing this. So for example, a pregnant woman getting herself exposed to certain toxic chemicals play into the possibility that she may have a miscarriage. But then, if she did not deliberately expose herself to such, it cannot be classified as an abortion. The second thing to consider, which is what differentiates the both, is intervention. In abortion, medical intervention is always needed. So that's why we have broadly two forms of abortion. We have the surgical abortion, and we have the medical one, the one that has to do with drugs. Because for that pregnancy to be terminated, something medically has to be done. It has to be intervened. Either you go for a surgery or you have to take certain medication or certain drugs. But in the case of a miscarriage, there's no medical intervention. If there is a medical intervention, or when the medical intervention comes, it always comes after the fact, after the pregnancy had already been lost. And oftentimes, this intervention is to prevent complication. So already the pregnancy has been lost. So you've been taken to the hospital to ensure that we look at you, we ensure that there's no infection, that everything is being cleared from the uterus to ensure that, other things are not affected. But in abortion, there is always intervention from the very beginning. Something has to be taken to set off the whole process. But in the form of miscarriage, nothing is taken; it just happens naturally, and then every intervention that comes after the fact. The next one is timing. An abortion can happen anytime, depending on what the individual wants and the services available. So somebody can wake up at 6 months and said, I do not want this child again, or I do not want the growth of this product of conception. And that keeps happening. It could be at 1 week, it could be at 2 weeks, 3 weeks, 4 weeks. But then in miscarriage, a miscarriage can only happen before 20 weeks of gestation. Because oftentimes, if naturally the product of conception wants to leave after 20 weeks, it's seen as a premature birth, no more as a miscarriage, because the product that comes out as at that time can be put in an incubator and it will grow and mature into a full functioning baby. So for abortion, this pregnancy termination can choose to happen at any time based on what the individual wants. But in miscarriage, if it's to be spontaneous, if it's to be non-deliberate, it has to happen before 20 weeks. Because after 20 weeks, it could be seen as a form of premature delivery, as the case may be. Then the cause is also another thing to factor in. What causes this termination of pregnancy? Like I said, if you deliberately took a drug or you deliberately undergo a surgical procedure, that falls into abortion. But then, if what was the cause was not deliberate, right? I fell down and I hit myself. Mistakenly, I had trauma to my tummy. Someone hit me. Then, or maybe I took this drug and I did not know that this drug has effect on pregnancies. This drug has effect on conception. Then that could be classified as miscarriage. I talked about exposure. Oh, I didn't know, and I walked into this place and I got myself exposed to this thing, and it led to this. But then, when it comes to abortion, it is deliberate. The causes are basically two. Is it a drug you take, or it's either you undergo a surgical procedure? And I think that some people may want to consider may have to be the types. Like I said, we have only medical and surgical abortion. So it's either drugs or it's either surgery. But in miscarriages, there are so many types. We have spontaneous miscarriages, we have threatened miscarriages, we have complete miscarriages, we have incomplete. So for something like spontaneous, it just happened. There was no prior signs to show that this possibly could happen. So you could hear somebody say a thing like, I was walking on the road and maybe I was coming back from the market and I just looked down and I'm seeing blood running down my legs. Then we have the threatened form. So in this threatened form, it is that there are signs, but then it has not yet happened yet. So we call that a threatened form of miscarriages. So oftentimes when this form comes, such a person is advised to go to a health facility to get themselves checked out first and foremost. Sometimes a threatened miscarriage becomes a full-blown miscarriage. Sometimes it may just stop that being threatened, and that pregnancy can be managed till the person delivers the baby. Or sometimes it can happen. But for the complete and the incomplete, sometimes every other product of conception, including the placenta, comes out during a miscarriage when it's spontaneous. So that one, we say that is a complete form of miscarriage. Sometimes some of the product of conception may be left inside the womb. As in the case of the woman I read in the story, that was why she had to go for manual vacuum aspiration, meaning that there were some things left inside the uterus and it had to be brought out mechanically. So while miscarriages have different types based on who is classifying it, some classify it in 3 ways, 4, 5, depends on who is classifying it. Abortion is classified just 2 ways. Either the one that is caused by the person deliberately using a drug or going for a surgical procedure. So we look back at it and we know that what differentiates these two, the both have termination of pregnancy, but what differentiates the two is intent, intervention, timing, and also the causes of such. So if you're just joining us, this is the Intimate Matters podcast. And on this podcast, we talk about sexual and reproductive health issues. Do well to subscribe to our channel and also click the notification button, and also follow us on all our social media platforms, on TikTok, on Facebook, on Instagram, and also join our private WhatsApp channel. Today we were making the distinction between abortion and miscarriages, talking about the 4 factors that differentiate these from this, being the intent, the intervention, the timing, and the causes. So when next somebody loses a pregnancy and you're tempted to say that the person did an abortion or possibly it was a miscarriage, it's important that you ask the person about these 4 things. What was your intent? Was it intentional? Were you deliberate about losing this pregnancy? Was there any form of intervention? Did you need a medical intervention before this pregnancy loss process could start? When did this loss happen, and what could be the possible causes? This will help to guide you to know if this was an abortion or if this was a miscarriage. Nonetheless, it's important that you do not shame anyone for having a choice or choosing whatever it is to do with their conception. If somebody gets pregnant, it is their choice to decide what they want to do with their product of conception, based on their own values, based on their own ethics, based on their cultural beliefs, and based also on their religious beliefs. If you're a healthcare provider, your job is to provide the services that you are paid, that you had sworn an oath that you're going to provide to such a person. So I believe that with this, we've been able to know the difference between abortion and a miscarriage. Do well to reach out to us on our WhatsApp channel and suggest topics, and we'll be glad to indulge you. My name is Nurse Akwawaban, and as always, I am the host of the Intimate Matters podcast. And until we come away next time, this is goodbye.